There's this thing I've noticed over the years, and it's not dramatic, it's not sudden, and it doesn't announce itself with clarity. It's more like a shift. Someone will mention that their appetite has changed a little. Not gone, just different. Or they'll say they've been feeling more tired than usual, but they can't quite put their finger on why. And then, maybe a few weeks later, they'll mention something else. A small ache that doesn't go away. A sense that their body isn't responding the way it used to. These things don't arrive with alarms. They slip in quietly, and that's exactly why they're so easy to dismiss. But when you start to see them together, when you begin to notice that they're not random, that they're part of a pattern, something shifts. Not into fear, but into awareness, into the kind of attention that says, maybe this is worth understanding. I want to tell you about someone I saw a few years ago. Let's call him Robert. He was in his late 60s, still working part-time, still active in his community. He came in for a routine visit, and when I asked how he'd been, he paused. That pause alone told me something. He said he'd been feeling a little off for a couple of months. Nothing he could name exactly, just off. His wife had mentioned that he seemed quieter lately. He'd been going to bed earlier. He'd stopped going on his usual weekend walks. When I asked why, he shrugged and said he just didn't feel like it anymore. He thought maybe it was age. Maybe it was the weather. Maybe it was nothing. But here's the thing. When someone tells you they feel off and they can't quite explain it, that's not nothing. That's information. It's just not the kind of information we're trained to recognize because it doesn't fit neatly into a symptom checklist. It doesn't sound urgent. It sounds vague. And we've been taught, culturally, to dismiss vagueness, to wait until something becomes clear, measurable, undeniable. But the body doesn't always work that way. The body communicates in whispers before it shouts. And if you're over 60, if you've lived in your body for decades, you know what normal feels like. So when normal starts to shift, even subtly, that's worth paying attention to. Robert and I talked for a while that day. I asked him about his appetite. He said it was fine, mostly, maybe a little less interested in dinner, maybe eating smaller portions. But nothing dramatic. I asked about weight. He thought he might have lost a few pounds, but he wasn't sure. He hadn't been weighing himself. I asked about pain. He said no, not really. Well, maybe a little discomfort in his abdomen now and then. But it would come and go. It wasn't constant. It wasn't sharp. It was just there. And that word, just, is one I've learned to listen for, because when someone says something is just there, what they're often telling you is that they've been trying to minimize it, trying to convince themselves it's not worth worrying about. So we did some basic exams. Nothing invasive at first, just looking, listening, feeling. His abdomen felt a little firm in one area. Not painful when I pressed, but not quite right either. I asked if he'd noticed any changes in his bowel habits. He hesitated again. Said yes, actually, now that I mentioned it. Things had been a little irregular. Not terrible, but different. And that word again. Different. Not broken. Not alarming. Just different. And that difference, that subtle shift in the rhythm of his body, was the thread we needed to pull. I want to pause here because I think this is where a lot of people get stuck. We're looking for the big sign. The unmistakable symptom, the thing that forces us to act. But the body doesn't always give us that. Especially with certain conditions, especially with cancer, the early signals are often small. They're changes in baseline. They're disruptions in rhythm. And if you're waiting for something undeniable, you might wait too long. Not because you're careless, but because you're trying to be reasonable. You're trying not to overreact. And that's a balance we all struggle with. Robert's case turned out to be colon cancer. Caught early enough that treatment was effective, but not so early that we could ignore the fact that he'd been feeling off for months before he said anything. And when we talked about it later, after the diagnosis, after the treatment plan was in place, he told me something that stuck with me. He said he'd been noticing these changes for a while, but he kept telling himself they weren't connected. The fatigue was just age. The appetite was just stress. The abdominal discomfort was just digestion. He'd been explaining each piece separately, trying to make sense of them individually, and in doing so, he'd missed the pattern. He'd missed the fact that his body was trying to tell him something as a whole, not as a list of isolated complaints. And that's what I want to talk about today. Not a checklist of cancer symptoms, because you've probably seen those lists before, and they're useful, but they're also limited. What I want to talk about is how to think about your body as a system. How to notice when that system is starting to send signals that something's shifting. And how to trust that noticing, even when it feels vague, even when it feels like maybe you're just getting older, or maybe you're just imagining things. Because here's the truth. Your body is an incredibly complex network of signals. It's not just one system doing one thing. It's dozens of systems coordinating, constantly adjusting, constantly communicating. And when something starts to go wrong, when a group of cells starts behaving differently, the body doesn't always know how to label that. It just knows that something's changed. So it sends out signals. Fatigue, because energy is being redirected. Appetite changes, because metabolic priorities are shifting. Discomfort, because tissues are being pressed or inflamed or irritated in ways they shouldn't be. Weight loss, because the body's using resources differently. These aren't random, they're feedback. They're the body's way of saying something here isn't working the way it used to. But here's where it gets tricky. These same signals can happen for 100 other reasons. Fatigue can be poor sleep. Appetite changes can be medication side effects. Weight loss can be stress. Discomfort can be muscle strain. And so we explain them away. We find the simpler answer. And most of the time, that simpler answer is right. Most of the time, these signals are exactly what they seem to be. Temporary, situational, fixable, but not always. And the question is, how do you know when to dig deeper? I think the answer lies in duration and pattern. If something changes and it goes away in a week or two, that's probably situational. Your body adjusted, your life adjusted, the signal faded. But if something changes and it stays, or if it comes back, or if it starts to cluster with other changes, that's when the pattern starts to matter. That's when you're not looking at isolated events anymore. You're looking at a shift in how your system is functioning, and that's worth exploring. Let me give you an example. Let's say you notice you're more tired than usual. Okay, that could be anything, but then you also notice that you're not bouncing back after rest the way you used to. You sleep a full night, and you still wake up feeling drained. That's a second data point. Then maybe you notice that your weight has dropped a little, even though you haven't changed your eating habits. That's a third. Then maybe you notice a persistent cough, or a change in your digestion, or a small lump you hadn't felt before. Now you're not just tired. You're tired plus weight loss plus something else. And that combination, that clustering, is what shifts this from probably nothing to worth checking out. Robert's pattern was fatigue, appetite change, weight loss, and abdominal discomfort. None of those things alone would have been alarming. But together, over weeks, they formed a picture. And the picture mattered more than any single symptom. Now, let's talk about what this actually feels like, because I think that's where a lot of the confusion comes in. When we talk about cancer symptoms, we tend to use very clinical language. Unexplained weight loss, persistent fatigue, changes in bowel habits, and those are accurate, but they're also a little cold. They don't capture the lived experience of what it feels like to notice these things. So let me try to describe it differently. You wake up one morning and you just don't feel quite right. Not sick, exactly. Not in pain, just not yourself. You go through your day and everything feels a little harder than it should. You're moving a little slower. You're less interested in the things that usually bring you joy. You eat dinner, but you don't finish it, and you're not sure why. You tell yourself it's fine. You tell yourself everyone has days like this. And you're right, everyone does. But then the next day is the same, and the day after that. And slowly, over weeks, you realize that this isn't a bad day. This is your new baseline. And that realization, that quiet recognition that something has shifted, that's the signal. Or maybe it's physical. Maybe you notice a small ache in your side. It's not sharp. It's not constant. It's just there in the background, like a low hum. You press on it, and it doesn't hurt more. You move, and it doesn't get worse. So you ignore it. But then, a week later, it's still there. And 2 weeks later, it's still there. And you start to wonder, why isn't this going away? Why isn't my body fixing this the way it usually does? Or maybe it's something you see, a mole that's changed shape, a spot on your skin that looks different than it used to, a small lump under your arm or in your neck. You notice it, and you think, that's new. And then you think, well, I'll keep an eye on it. And that's reasonable. But the question is, what does keeping an eye on it actually mean? Does it mean checking it once a week? Does it mean measuring it? Does it mean showing someone else? Or does it mean just vaguely remembering that it's there and hoping it goes away? Because here's what I've seen happen. People notice something. They tell themselves they'll watch it. And then life gets busy, and they forget to watch it. Or they watch it, but they don't write anything down. And weeks turn into months. And by the time they come in, the thing they noticed has grown or changed or spread. And they feel guilty. They feel like they should have acted sooner. But the truth is, they didn't have a clear rule for when to act. They were waiting for the thing to become undeniable, and in the meantime, they were stuck in this uncomfortable middle space of knowing something might be wrong, but not knowing if it's wrong enough to do something about. So let me give you a rule. It's not perfect, but it's something. If you notice a change in your body, and that change lasts more than 2 weeks without a clear explanation, write it down. Not in your head, on paper, or in your phone. Somewhere you can see it. Write down what you noticed, when you noticed it, and how it's affecting you. Then, if it's still there 2 weeks later, that's your signal to bring it up with someone. Not because it's definitely cancer, not because you're overreacting, but because a change that persists for a month is worth understanding. And here's why that rule helps. It takes the guesswork out of it. It gives you a clear action step. It removes the guilt and the second guessing. You're not ignoring it, but you're also not panicking. You're observing, documenting, and then deciding based on what you see. And that's a much calmer, more grounded way to approach this. Now, let's talk about the types of changes that matter most. And I want to be clear, this isn't an exhaustive list. This isn't every possible symptom, but these are the patterns I see most often in people who turn out to have something that needs attention. First, persistent fatigue that doesn't improve with rest. This is different from being tired after a long day. This is waking up tired, feeling drained even when you haven't done much, needing to nap more often, feeling like your energy has just leaked out and you can't get it back. And it's not explained by poor sleep or a change in activity level. It's just there. Second, unintended weight loss. And by that, I mean losing more than 5 or 10 pounds over a few months without trying, without dieting, without increasing exercise. Your clothes fit differently. People comment that you look thinner, and you're not sure why. That's worth noting. Third, changes in appetite or digestion. Maybe food doesn't taste the same. Maybe you feel full faster than you used to. Maybe you're having persistent nausea, or heartburn, or a sense that your stomach just isn't working right. Or maybe your bowel habits have changed. You're constipated when you're usually not. Or you're having diarrhea. Or you're seeing blood in your stool. Any of those things, if they persist, are worth exploring. Fourth, pain or discomfort that doesn't go away. And this can be anywhere. A headache that lasts for weeks. Back pain that doesn't respond to usual treatments. Chest discomfort, abdominal pain, bone pain. The key here is persistence. Pain that comes and goes might be muscular or situational. Pain that stays or that keeps coming back in the same spot is different. Fifth, changes you can see or feel. A lump, a swollen lymph node, a mole that's changed color or shape, a sore that won't heal, a persistent cough or hoarseness, unusual bleeding, whether that's coughing up blood, blood in urine, or vaginal bleeding after menopause. These are visible, tangible changes, and they're often easier to recognize because they're concrete, but they still require the same decision-making process. Notice, document, follow up if it persists. And sixth, a general sense that something's wrong. I know that sounds vague, and it is, but I've learned to take it seriously. Your body has an incredible ability to sense when something's off even before you can name it. You might not have a specific symptom, but you just feel different. You feel like something's shifted, and if that feeling persists, if it doesn't go away, it's worth mentioning. Not because it's definitely something serious, but because your intuition is data too. Now, here's where the electrical circuit metaphor comes in, and I think it helps make sense of all this. Think of your body as a complex electrical system. Every organ, every tissue, every cell is sending and receiving signals. When everything's working well, those signals are clean. They're coordinated. The system hums along. But when something starts to go wrong, when a group of cells starts behaving abnormally, it's like introducing noise into the circuit. The signals get a little scrambled. The system has to work harder to maintain balance. And that extra effort, that scrambling, is what you feel as symptoms. Fatigue is the system diverting energy to deal with the problem. Weight loss is the system burning through resources, trying to fight or compensate. Pain is the system signaling that something's being compressed or damaged. Changes in appetite or digestion are the system reprioritizing which functions get energy and attention. It's all feedback. It's all the body trying to tell you that the circuit isn't running smoothly anymore. And just like with an electrical circuit, the problem might be localized, but the effects can be widespread. A short in one part of the system can cause flickering lights somewhere else. A tumor in your colon can cause fatigue throughout your whole body. A growth in your lung can affect your appetite. The body is connected, and that's why you can't just look at one symptom in isolation. You have to look at the whole system. So what do you do with this information? How do you actually use it in your daily life without becoming hypervigilant or anxious? Here's a practice that takes less than a minute and can make a real difference. Once a week, maybe on the same day each week, do a quick body scan. Not a medical exam, just to check in. Sit quietly for 30 seconds and ask yourself, how do I feel compared to last week? Is my energy the same? Is my appetite the same? Is my sleep the same? Are there any new aches or discomforts? Have I noticed any changes in my skin, my digestion, my breathing? You're not diagnosing anything. You're just noticing. You're establishing a baseline. And if something changes, you'll catch it early because you've been paying attention. And then, if you do notice something, write it down. Keep a simple log. Date, symptom, how it's affecting you. That's it. You don't need paragraphs. You don't need detail. Just enough that 2 weeks later, you can look back and see if it's still there, if it's gotten worse, or if it's resolved on its own. This practice doesn't add stress. It reduces it. Because instead of vaguely worrying that something might be wrong, you're actively monitoring. You're taking control of the information, and if something does turn out to need attention, you'll have a record. You'll be able to tell your doctor exactly when it started, how it's progressed, and what patterns you've noticed. And that information is incredibly valuable. Now let's talk about what happens when you do bring something up with a doctor, because I think there's a fear that you'll be dismissed, or that you'll be told you're overreacting, or that you'll waste their time. And I want to address that directly. If you notice a change that's persisted for more than 2 weeks and you bring it up, you're not overreacting. You're being appropriately cautious. You're doing exactly what you should be doing. And any good clinician will take that seriously. They might not immediately order a battery of tests. They might start with questions, with an exam, with monitoring, but they'll take it seriously. And here's what you can do to make that conversation as productive as possible. Bring your log. Show them what you've noticed and when. Be specific about duration. Be specific about how it's affecting your daily life. Don't minimize it. Don't say, it's probably nothing, or I don't want to bother you. Just say, I've noticed this change. It's been going on for this long, and I wanted to get your thoughts. And if the first explanation doesn't resolve the issue, if the symptom persists or gets worse, follow up. Don't assume that because one test came back normal, everything's fine. Sometimes it takes multiple visits, multiple perspectives to figure out what's going on. And that's okay. That's part of the process. Robert and I had 3 visits before we figured out what was happening. The first visit, we talked and did a basic exam. The second visit, we did some blood work and imaging. The third visit, we had the diagnosis. And at no point did I think he was wasting my time. At no point did I think he was overreacting. He was noticing, documenting, and following up. And that's exactly what saved him. Now, I want to talk about something that doesn't get discussed enough, and that's the emotional side of this. Because noticing these changes, paying attention to your body, it can bring up fear. It can bring up anxiety. It can make you feel like you're waiting for something bad to happen, and I don't want to pretend that's not real. But here's what I've seen. The people who do best, the people who catch things early and manage them effectively, are not the people who ignore their fear. They're the people who acknowledge it and then act anyway. They say, yes, I'm scared. Yes, this is uncomfortable, but I'm going to pay attention because that's how I take care of myself. They don't let the fear paralyze them, but they also don't pretend it's not there. And there's a difference between vigilance and hypervigilance. Vigilance is checking in once a week, noticing patterns, and following up when something persists. Hypervigilance is checking your body 10 times a day, convincing yourself that every small sensation is a crisis, and losing sleep over things that haven't even happened yet. One is healthy, the other is exhausting. And if you find yourself sliding into hypervigilance, that's worth talking about too. Not because you're doing something wrong, but because anxiety itself can create physical symptoms, and you want to be able to distinguish between the two. So, how do you measure progress here? How do you know if you're doing this right? I think the answer is simple. If you're noticing changes, documenting them, and acting on them when they persist, you're doing it right. If you're having regular check-ins with your body and you feel more connected to what's happening inside you, you're doing it right. If you're catching things early, even small things, and addressing them before they become bigger problems, you're doing it right. You're not trying to become a medical expert. You're not trying to diagnose yourself. You're just trying to be an informed observer of your own body. And that's something you can absolutely do. Let me tell you what happened with Robert after his treatment. He recovered well. The cancer was caught early enough that surgery was effective and he didn't need extensive chemotherapy. But what changed for him, more than anything, was his relationship with his body. He told me that before this, he'd always thought of his body as something that just worked or didn't work, something that either functioned or broke down. But now he thinks of it as something that communicates, something that gives him information if he's willing to listen. And he does listen now. He does his weekly check-ins. He notices when something feels different. And he doesn't panic, but he also doesn't ignore it. He brings it up. He asks questions. And because of that, we've caught a few other small things over the years. Nothing major, nothing life-threatening. But things that were easier to address because we caught them early. And that's what I want for you. Not fear, not hypervigilance, but awareness. Connection, trust in your ability to notice when something's not quite right, and confidence in your ability to act on that noticing. Because here's the thing, cancer is not always preventable. Sometimes it happens despite everything you do right, but it is often detectable. And the earlier you detect it, the more options you have, the better the outcomes tend to be. And detection starts with noticing. It starts with paying attention. It starts with trusting that the small changes, the vague discomforts, the shifts in how you feel are worth taking seriously. You don't need to become obsessed with your health. You don't need to spend every day worrying about what might go wrong. But you do need to stay connected. You need to know what normal feels like for you so that when it changes, you recognize it. And you need to have a plan for what to do when you notice something so that you're not stuck in that uncomfortable space of knowing something's off, but not knowing what to do about it. The plan is simple. Notice. Document. Follow up if it persists. That's it. 3 steps. And those 3 steps can make all the difference. I also want to say this. If you're someone who's had cancer before, or if you've had a close call, this process might feel different for you. You might be more attuned to changes because you've been through it. Or you might be more anxious because you're worried about recurrence, and both of those reactions are completely understandable. But the same principles apply. Notice, document, follow up. Don't let fear drive every decision, but don't ignore the information your body's giving you either. And if you're someone who's never had a serious health issue, if you've been fortunate enough to feel well for most of your life, this might feel unnecessary. It might feel like worrying about something that's unlikely to happen. But the statistics tell a different story. By age 65, 1 in 2 men and 1 in 3 women will be diagnosed with cancer at some point in their remaining years. That's not meant to scare you. It's meant to remind you that vigilance is not paranoia. It's realism. It's taking care of yourself in a way that acknowledges the realities of aging without letting those realities define you. So where does that leave us? What's the takeaway here? I think it's this. Your body is always communicating. It's always sending signals. And most of the time, those signals are routine. They're just the body doing its job, adjusting to stress or activity or changes in environment. But sometimes, those signals are telling you that something deeper is shifting, that something needs attention. And the only way to know the difference is to pay attention, to notice, to document, to act when something persists. You don't need to be afraid. You don't need to assume the worst. But you do need to take yourself seriously. You need to trust that you know your body better than anyone else does, and that when something feels different, that's information worth exploring. Robert's story had a good outcome because he didn't wait for the signal to become undeniable. He noticed, he spoke up, and we acted, and that's what I want for you. Not a guarantee that nothing will ever go wrong, because I can't offer that, but a framework for noticing when something might be going wrong, and a plan for what to do about it. Take 60 seconds once a week. Check in with yourself. Notice how you feel. Write down anything that's changed. And if something persists, bring it up. That's it. That's the practice, and it might just save your life. If you found this helpful, I'd appreciate it if you'd take a moment to like this episode and subscribe to Everyday Health Podcast. Turn on notifications so you don't miss future conversations. And here's a question for you. When was the last time you did a real check-in with your body, not just going through the motions, but actually noticing how you feel? Share your thoughts if you'd like. I'd be curious to hear.